Welcome to iPEMS, a podcast series that teaches about pediatric emergency medication safety and equips providers with strategies for solutions. I am your host, Dr. Tiffani Johnson of the Emergency Medical Services for Children National Resource Center. Joining us for this episode is Dr. Evaline Allessandrini of the Cincinnati Children's Hospital. She's also one of the Targeted Issues grantees through the EMSC program, and she's working on a project related to performance measures for pediatric emergency medical care. Can you start off by explaining to our audience what performance measures are and how they're used in medical care?
Sure. So performance measures is a process by which you define the end results that you want your organization to get. And so if you haven't defined what the end result is, it's hard to know how to get there, or if the things that you're doing are helping you on the way. So it's a really important way to understand the quality of care that you're providing in your organization.
And can you tell us a little bit more about the research project that you're working on to define quality performance measures in pediatric emergency medical care?
Sure. So I think a lot of it started from understanding what was out there in the literature and what was being used in pediatric emergency care. And what we found was that a lot of the measures out there were very much related to ED throughput and the timeliness of care that was being provided. So we thought that that's not enough, that we don't want to just understand the quality of care that's delivered to kids in emergency department by how quickly you provide the care, but that there was a large gap in performance measures to help us to understand how quality was assessed throughout the entire continuum of care. And we thought about, we wanted to make sure that the measures that we're putting forward to evaluate the quality of emergency care for kids were balanced across the Institute of Medicine domains. And most people know that those 6 domains are, is care effective? Is it safe? Is it patient-centered? Is it equitable? Is it timely? And is it efficient? So we wanted to make sure that we had measures that were relevant to all of those domains. The second dimension that we were really focused on was something called the Donabadian framework. And so Donabadian has a structure for quality that he categorizes in terms of structure, process, and outcome. So structure are sort of those resources and personnel that exist to assure that you're providing quality of care. So the number of nurses that you have in the ED that are capable of administering a narcotic medication would be a good example of a structure measure. And then we wanted to make sure that we had some process measures. So a process measure is assessing the method or the process by which you deliver care. So if we're thinking about medications and medication safety, it might be, do you have a process in place by which you double check medications before you deliver them, and how often does your staff comply with that? So that would be a process measure. And then finally, we really wanted to make sure we had outcome measures, because outcome measures are what's important to the patient and what's important to a family. And so those things have to do with reducing pain, increasing life, enhancing satisfaction. And so a good example of an outcome measure was, did you reduce pain by giving a narcotic medication for a long bone fracture? We also wanted to make sure that we had measures that were attributed to diseases that were common and diseases that were severe. So that was the third dimension that we looked at.
And through this project, were you able to identify any performance measures related to pediatric medication safety?
Of the 333 measures that we started with, measuring medication error rates showed up in the top 8 of all of those measures. There are definitely methods of measuring medication errors and medication safety out there. The issue right now in 2010 are several-fold. There are not uniform ways to measure it and assess it. So one ED might be doing it one way, another ED another way, and they're not particularly comparable. And also, a lot of the methodologies to measure medication errors are complex, and often at this point in time not something that's readily retrievable from an emergency department electronic data source. So it is requiring a lot of chart review and things like that.
One of the issues that we've discussed in other episodes is the importance of weighing patients in kilograms. Have you identified any performance measures related to weighing all of the patients in kilograms instead of pounds?
Oh, that's a really good question. Okay, so Another measure that made it into our top 8 is a measure that is a process measure that assesses whether emergency departments are measuring children's weight in kilograms at the time of the ED visit. And that's a really critical thing for medication safety. We know that one of the most common problems is that in lieu of documenting a weight in kilograms, people may put down the weight in pounds. And if that's the case, then the medication that will get administered to a child, because doses of medication are calculated based upon kilograms, they'll get a 2.2 times the dose of medication. And for some medications that might not cause a lot of harm to the patient, but for other medications, insulin is an example, it could really cause significant harm to the patient. The second thing to notice about that and why it's important to measure weight is that we know that historically healthcare providers' estimation of weight is pretty inaccurate. And so that's another reason why it's really important to get children on a scale. And there's been lots of recommendations to lock your scale so that it can only measure in kilograms, that there's not even the option of measuring in weight, the weight in pounds.
And finally, do you have any advice for the medical students, residents, and fellowship trainees who are listening to this podcast related to performance improvement and pediatric medication safety?
Oh, I definitely do. So I think one of the things is that it's really important to remember that we all need to work together as a team, and that we have a common goal. And so clearly, if we're working together as a team and you have a physician working together with a nurse who's working together with a pharmacist, all of those checks are really going to, to be in place will help us to reduce medication errors. I think just another thing too is that it's important not to be ashamed to share your data, so that if you are measuring performance and you're not doing so well, it's okay. We have to enhance our culture to get it out there and to also see how other people are doing, because it's only by sharing our data that we can figure out who's doing it really well, so we can go to that ED and say, hey, what do you do that we can apply in our emergency department to help to decrease medication errors?
Well, thank you so much for joining us today, Dr. Allessandrini, and providing an overview of what performance measures are. We've discussed a lot in other podcast series about what the problems are, and in order to truly develop solutions, we need to be able to measure those problems and know where we are in order to benchmark where we need to go. Thank you to our audience for listening to this episode of iPEMS. To learn more about pediatric medication safety in the emergency medical setting, please tune into other episodes of the iPEMS series.